Welcome to Moments with Marianne. This is your host, Marianne Pastana, and we're here today with special guest, Pharmacist Joshua Fredell, who's here to share with us maximizing prescription drug benefits. Did you know that 1 in 5 adults skip filling their prescriptions because of the cost? And that many may be missing out on valuable savings and benefits they didn't even know they had. Well, today's guest is here to share with us just that. Joshua Fredell, a pharmacist and senior vice president, serves as head of PBM and specialty product innovation at CVS Health. So welcome to the show, Pharmacist Joshua Fredell.
Thank you, Marianne.
Well, what an honor it is to have you here and to talk about this. My goodness, with the skyrocketing costs of prescription medications, it's such a growing crisis for so many Americans. How can people cope with this troubling trend without compromising their health?
That's a great question, and I know it's the top of mind for so many of us, the affordability of medications. It starts with how the drugs are priced by the makers of those very drugs. But from there, it goes into how does each prescription drug benefit cover those medications and at what copay tier? So one of the first things I enjoy talking to patients about is let's look at your prescription drug benefit. Let's look at the formulary and let's see where your medications fall. There are actually lower cost options for just about every chronic condition today. So that's one of the first things I'd be focusing on to help someone just figure out how do I afford my medications and how do I use them well.
So what are some key steps to make the most of our benefits?
Yeah, first step is we're going to take a look at the prescription drug benefit itself. As I mentioned, there can be different tiers for a lot of people based on their formulary. Today, if you're using a medication for, let's say, diabetes or high blood pressure or even high cholesterol, there are going to be a lot of effective and safe generic medications. That might be a great choice for people, and it could be the lowest cost for them. If that doesn't work, we'd be looking at some of the other brand medications that could also be a great choice for them. I'm certainly going to want them to talk to their doctor or their individual pharmacist about the right fit, but there are choices there that they can be doing. And one other thing, even for some of the more rare conditions where injectable biologic drugs are needed, there are lower cost options called biosimilars for some of those as well. These are really important places where I would start to help patients see where there might be more affordable options for them.
It seems that many people can feel really overwhelmed by the fine print of their insurance plans. So what are some common mistakes patients make when it comes to understanding their prescription coverage?
Yeah, I think maybe it's not so much a mistake, it's a misstep. The first step is just learning. There's a lot of information that your pharmacy benefit manager can provide. And as an aside, a pharmacy benefit manager is there to do what that name says, help manage the pharmacy benefit. And as part of that, they're going to have a lot of information about what the medications are, what they're used for. But to your question, also, how much do they cost? Most of them have great websites and tools where you can literally check the cost of your drug, see what it's going to cost you if you go into any pharmacy today, but also tell you what other options may be and what they may cost. So I think the first step I'd recommend is go get that information, whether it's from your pharmacy benefit manager, talk to your local pharmacist. They can also look up the price of medications. It's really important that we arm ourselves with that information to know what are our options, what do they cost, and from there we can make some really good decisions.
It seems that high deductible plans can be very intimidating for a lot of people. So if someone is to take that first step to ensure they're not overspending, what would you suggest?
Yeah, high deductible plans. That's a great question. And within those designs, it really means for certain things and certain medications, the full cost will be paid by the patient until that deductible is met. One really important thing is in many prescription drug benefits, they often have what's called a preventive drug list. These are medications that even during your deductible will often cost you no out-of-pocket cost or a very low copay. So the first thing I'd be sitting down with a patient to look at is let's see if your plan has a preventive drug list. If it doesn't, go back to some of the things I mentioned before. Maybe there's a lower cost medication that you could be using during that time. And then finally, honestly, we'll look at other sources of potential support. Many drug manufacturers offer copay assistance through their websites or other tools. We'd be looking at those as well, all as ways to help patients find the right affordability, especially during that all-important deductible period.
You really know your stuff. Is this what most pharmacists, they have a great understanding of the plans and how to best kind of advise somebody?
I think just about every pharmacist is going to know a lot of these key things, but clearly one challenge is there's a lot of different health plan and insurance plans out there in the United States and even in any given state or city, but they can certainly direct any patient towards tools, other information, or even support groups around their condition that'll help those patients find the more individual, tailored information that they probably need.
So, why is it so important to take care of our health and avoid shortcuts?
Great question. A shortcut today can often be a much bigger problem down the line, and that's true if you're driving your car someplace. It's certainly true inside of healthcare as well. Medication adherence is one of the most important things anyone can do. Using the medication as prescribed by their doctor. It can seem like a simple little thing to start skipping doses here and there now, but that can lead to more problems in time. In fact, it's estimated that actually 1 in 4 hospitalization is due to someone just not taking their medication as they were supposed to. And so one of the best ways we can save money for ourselves and for the healthcare system in the future is to do our best to take the medications we need to take today.
Are those some of the tips that we should really kind of pay attention to?
It really is. And to be more practical, as a quick story, I've helped a few family members, including my father, actually set up reminders to do that. And I would suggest everyone consider 2 types of reminders. There are lots of tools offered, again, by your health insurance plan or maybe your local pharmacy or their mobile app, but set reminders to help you to remember to take your medication each day. So that daily reminder or whatever the frequency is for the medication, really important to set that reminder. The second is what many people call a refill reminder. It's time to refill your medication. To take that step to go to the local pharmacy to pick it up, or maybe to submit that request to have it delivered to your home. If you're doing those 2 things, I think people will help themselves quite a bit. Just take a little bit of that work out of remembering to refill their medication on time as well to take it on time.
Now, does CVS help us with reminders too?
We do. CVS offers both of those reminder steps, and we'll even go one step further in helping just to kind of coordinate their multiple medications together. We don't necessarily want someone to have to come to the pharmacy 4 times in a month. We can kind of consolidate those together so you can make one trip, get what you need, and then hopefully go about your day and your week and your month.
That can get really confusing if you're taking multiple prescriptions to try to figure out when to take them, when to pick them up. So that's such a great resource.
Thank you.
Do you have any suggestions for people to be able to connect with experts and to tap into resources offered and really build a supportive community?
A great question. I would suggest 3 things. I've mentioned before, just use the information that your pharmacy benefit manager or your health insurance coverage may provide. A really good source of information, again, about health conditions, about your medications, and a lot of other things. Talk to your local pharmacist. Talk to your doctor. They can refer you to just both general information, but also those specific things that I think you're getting to, which is the third. There could be, support groups and other ways to connect with people who are treating the same condition that you're treating for your health, using similar medications that you're using. Great way to get tips and information just to kind of go through this experience with a community. They can also help with things that go outside of the medicine. For a lot of these conditions, changing things in our lifestyle can have a really positive impact on our health, and that positive impact can also help us lower our cost. So a community like that could help patients find those types of tips as well.
And a good place to start is with our pharmacist?
Definitely talk to your pharmacist. You can talk to your doctor. There's also great organizations online for a lot of the common conditions people have today. Those are all great places to start to find some more information and ways to help you as an individual.
So I know some prescriptions require pre-authorization. So how do we navigate that?
Start with some of those digital tools or online tools from the pharmacy benefit manager or from your health insurance. The vast majority of them will indicate, one, if a medication does require that pre-certification, they'll oftentimes provide information about that pre-certification. That's also a really important thing to talk with your doctor about. Most of their electronic medical record devices in their offices will also indicate that. And there's really 2 things you can do with that information. One, really important to know that's needed, because that just may be an added step that the doctor needs to take, and you want them to go ahead and take that step. But second, these tools can also indicate other medications that don't require that pre-certification, that also could be a really good choice for the doctor and the patient to choose.
So what role do preventative services and maybe wellness programs play in reducing long-term prescription costs?
Preventive or wellness services play a really important role. When we look at a lot of the healthcare conditions that people have today, almost all of them can be improved with some form of preventative step, wellness step, or lifestyle change. Whether that's getting the right screenings and doctor evaluations on a regular basis to catch something early, because if we catch something early, it can usually be treated sometimes without medication or with pretty simple low-cost medications. But also those changes can help improve the condition itself. A little bit of exercise and a little bit of difference in our diet can make a world of difference in lowering cholesterol, lowering blood pressure, helping with the management of diabetes. So all of those things, from a wellness to prevention to lifestyle changes, can have a huge impact on helping us be healthier and helping us afford healthcare a bit better.
What are some of the most overlooked resources that are available to people?
You hit on one. A lot of folks want to first go to information about the medication, which is really important, but look into those other things around wellness, prevention, and lifestyle. Again, your health insurance company, your local pharmacy, your pharmacy benefit manager, probably all will provide some level of information about those. And if you need more, then great opportunity to talk to your doctor or other healthcare professionals to get more detail. So I would strongly suggest that. And then second, and something we've talked about before, better know your options. At any point in time, a medication may seem like it's not working as well, may have a side effect, or again, the price may be higher. Knowing what other options you have give you great ways to talk again with your doctor and pharmacist about those other options, helping you take those healthy next steps.
So where can people go to learn more about the programs offered?
From my perspective, you can certainly go to cvshealth.com. A lot of great information there. Use the website and tools that your local pharmacy has available, but also check the website of your personal pharmacy benefit manager or your health insurance coverage. All of those are great places to start for the information we've been talking about here.
Well, Joshua, thank you so much for taking the time to be on the show with us here today.
Yeah, thank you for having me.
Make sure to visit cvshealth.com and learn how you can maximize your prescription drug benefits. Well, we're at the end of our time today. I'd like to thank everyone for tuning in. You've been listening to Moments with Marianne, where we make every moment count.
In a single moment, your life can change. Moments with Marianne is a transformative hour that covers an endless array of topics with the best of the best. Her guests are leaders in their fields, ranging from inspirational authors, top industry leaders, and business and spiritual entrepreneurs. Each guest is gifted and a true visionary, a recognized leader in her own work, and while teaching others to develop, refocus, and grow, Marianne will bring the best guest and sometimes a special surprise. Don't miss this. You never know just which moment will change your life forever. Make sure to tune in and visit momentswithmarianne.com for more information.